Sorry, folks, still a construction zone. Miller Building's not open for tours yet.
So, hi, welcome to this sneak peek tour of the Miller Building. We're going to be talking about how the spaces have been redesigned to support the kind of care we want to provide, really transforming the care environment for our patients. Now, there's input from patients and families to accomplish that, but also input from our staff to create the spaces they needed to provide the best possible care. And really, it would be great right now if there were a nurse around to explain all of that. And what do you know? Here's Craig Jones.
Hi, Mike.
He's a cardiothoracic and vascular surgery nurse on Shep 3 North. Thanks for being here.
Thank you for having me.
And where are we staying? I think it's a team station.
This is a team station. It's one of three. We've designed here in the Miller Building. It gets us closer to our patients and really allows us to collaborate with our patient care teams. But I think one of the really interesting things is this microstation, and I want to show it to you. One of the interesting features of the microstation, on top of the computer that allows us to chart as close to the patient as possible, are these blinds here, so that if I have a patient I'm worried about, I can watch them or adjust those blinds so they can maintain their privacy.
That's great. I'll explain later. Wow, look at all this space. One family, one patient. And as you know, the Miller Building is all about adding many more private rooms throughout the whole hospital, because we know that people heal better when they have privacy, when they have access to natural light, when there is space for their family and caregivers to be close to them. And as I understand it, you guys broke it down into 3 zones, and we are in the caregiver zone.
So this area allows us to wash our hands, chart at the bedside, prepare treatments, and discuss the care plan with the care team.
So now let's move to the patient zone. What are the main benefits for patients, do you think?
Number one is safe patient handling with the lifts that are available in all the rooms above the bed. Also a private bathroom complete with a shower.
And I understand that right opposite every patient bed is going to be an electronic whiteboard. What's that for?
That is so that they can access information to test results, vital signs, who their doctor, nurse, or other care team members are.
It's interesting, though, that we didn't buy any more beds. Beds we move into the Miller Building will create private rooms in the other buildings.
And even though we're not increasing the total number of beds for the entire campus, we're increasing our capacity. Since today, when patients can't have roommates due to infection risk or other clinical factors, we can't use the other beds in those rooms.
So now tell me about the family zone.
One thing our family and patient advisors requested was for us to have a place for them to hang out, sleep, and allow the patient to heal close to their loved ones or their support people. The area includes a recliner and a pull-out couch so that family members can sleep next to their loved ones.
Craig, thank you so much for the time. I know you actually have to go take care of some patients, but
You're very
appreciate all the
welcome.
help. So now I want to talk about some of the green features of the Miller Building, and that leads me to talking about sunglasses and blue jeans. Remember before when we talked about how it's good for patients to have natural light in their rooms? Well, it's also good sometimes to keep the light out if it's too strong. Our windows have special glazing that act just like sunglasses do that get darker as the sun gets stronger, and that's going to save us on cooling costs. But that's not the only green feature. The teams that built the Miller Building, 87% of whom are Vermonters, by the way, used recycled materials throughout, including recycled concrete, and the insulation in the walls is made from recycled blue jeans. Lots of blue jeans. Altogether, the heating and cooling systems are so efficient that we'll use half the energy that we otherwise would. Hey, how'd you guys get in here?
This is where we're going to be doing teaching rounds with the fellows, the residents, and the students. We'll be able to look at CAT scans, MRIs, echocardiograms, pull up the patient's EKGs and their charts, all without leaving the unit.
This makes it easy for faculty and students to get together and still be close to the patient's rooms.
That's great that you can be close to your patients. Having a door on either end of this room also gets to your patients closer. Also very handy if you have to get away from a security officer. Not that you'd ever have to do that, but I do. By the way, that space isn't just going to be used for teaching rounds. It's a multidisciplinary space that'll be used by doctors, nurses, case managers, and other care team members to collaborate.
Sir, I'm looking for somebody. He's around your height. You seen him?
Somebody this tall?
Yeah.
No.
Okay.
Well, I can't believe that worked. So here we are now at a medicine and supply closet with a Pyxis machine. There are several of these on every floor so that the nursing and support staff don't have to go far to get everything they need. So I think I'm pushing my luck with that security officer, so we should end the tour here. But we can't go without mentioning that this beautiful building was made possible in very large part by the generosity of not only Bobby and Holly Miller, but caregivers and staff of the UVM Medical Center, patients and families, community members. Altogether, $30 million of the cost of this project is coming from community support.
Ooh, time to go, sir.
Can you hold this?
Yes.